Incredibly knowledgeable guy, a very entertaining speaker, and I don't know exactly what he's going to talk about, but I wouldn't be surprised if he's going to tell you some things about what's happening in alternative cancer treatments and what it's like to go get treatment in Mexico for things, and what kind of successes they've had, and what things are easy and what things are hard, and whatever. It's going to be a really cool talk, I can tell you.
What was his name?
Gar Hildenbrand.
Okay, before I introduce Dr. Schellenberger, I want to mention the other speakers. The next month is Gary Taubes, the author of the book that just sold out, was getting more and more popular. And in November, well, I think we can wait till then. John Demisi and Dawson Church in December. Let me talk about Dr. Schellenberger. He's been practicing medicine for 37 years after graduating from the University of Maryland School of Medicine, receiving a postgraduate training at Mount Zion Hospital in San Francisco. He's one of only 16 physicians in Nevada that are licensed in conventional medicine as well as alternative and homeopathic. And he's able to integrate the best of both approaches. He's the author. Did you bring any books, Frank? Which one? The Energy?
I have a few of these. They're usually $15, but they're $10 for tonight if you want one.
And that's Bursting with Energy, the breakthrough method to renew youthful energy and restore health.
Another good book.
And he also wrote the Type 2 Diabetes Breakthrough, a revolutionary approach to treating that. He's a member of the American College for the Advancement of Medicine, that's ACAM, and the American Preventive Medical Association and the A4M. I'll skip through some of that. He's a pioneer in the clinical application of oxidative medicine, a new discipline that emphasizes the profound importance of oxygen and energy production in health and longevity. He's board certified in anti-aging medicine, and he was honored to speak in Monte Carlo at the first International Learning Conference on Anti-Aging Medicine. And he's the founding and medical director of Nevada Center of Alternative and Anti-Aging Medicine. I give you Frank Schell.
Well, good evening, everybody. It's a pleasure to be here, and Mike, you, and Dave, and the rest of you have just done such a fabulous job here. It's always fun. I don't like the drive down here because it's just hectic as heck. But it's great being here. Great being with you. So that shows up okay. All right. So about 25 years ago, is it 20? Yeah, it's more like 30 years ago. I heard about this weird thing that was going on in Germany, and that was that they were injecting ozone into people's knees for rheumatoid arthritis. And I thought, boy, that's crazy, especially since I had a patient with rheumatoid arthritis at the time that I wasn't helping out very much with really bad knees. So I went over to Cologne, Germany, and I spent a week there, and I studied under a Dr. Devon, whose father actually was the person that made the first ozone generator, and also a guy named Harold Wasserman, who did a lot of work with strokes and ozone therapy and such. And I came back home, and I bought myself my ozone generator, and I drew up some ozone and shot it into this lady's knee, and darn, she didn't get better. She went from a big old swollen fat knee to a nice skinny knee that seemed pain-free. And we did a few more of those, and darn it, didn't pretty much cure her knees. Well, about 2 weeks later, in comes her next-door neighbor, another little old lady, said, you know, I got a really bad knee. I want you to do what you did to this woman over here. And I argued with her. I said, now look, she has rheumatoid arthritis. You have a degenerative knee. You know, you're missing cartilage. You've got a whole different thing going on. That's an inflammatory condition. This is a degenerated condition. Yeah, true, both knees hurt, but they're entirely different pathologies. I can't guarantee you this is going to work. And she says, I don't care. It fixed her. And I argued with her. I said, well, you know, I don't know for sure. It might hurt you. It didn't hurt her. So I got to thinking about it and saying, you know, I've studied this stuff and I've learned about it, and it does seem to be harmless. So I told her, you know what, I'm not going to guarantee anything, but if you don't mind, I'll put it in there. I don't know what we have to lose. And that's how I learned about this. And for about 10 years, I want to tell you, I really didn't know what was going on. All I knew was if it hurt and I shoot ozone in it, it gets better. And in fact, I'm a cynical person. I'm an MD, so I'm by nature, I think, pretty cynical about anything. But I had to admit, this was working, and it was working phenomenally well. And next thing I know, somebody comes in, they got a bad back, somebody's got a bad shoulder, they got a bad this, and finally I run into this nurse, like maybe 10 years later, at a conference. And she's doing ozone on the sly down in Phoenix. And she says, you know what I do? I said, no, what do you do? She says, if it hurts someplace, I just inject ozone into it. I said, well, what do you mean? She says, I don't really know what I'm doing. But I don't know how to inject the knee, I don't know how to inject the shoulder, I don't know how to inject the back. So I just kind of put the needle kind of close where the problem is and shoot the ozone in there, and it gets well. Now I thought, boy, that's just screwy, it's just got to be placebo, you're making it up, you're exaggerating, something like that. So I thought, I'm going to give that a try. And so anyhow, this whole process that you're going to learn about tonight has been an evolution over about maybe 20 years. And at that point, I remember once a little old lady from, a lot of little old ladies, she came in from Miami. And learning about the second or the third treatment, she says, you know what, that ozone hurts a lot. And it does, it hurts quite a bit. When you inject ozone into tissue, it's like somebody just rubbing a knife around in there for about a minute and a half. It just hurts like heck. And she says, why didn't you put some Novocaine in there? I thought, yeah. My knee, I guarantee I would have thought it. So we stuck some Novocaine in there, and then a couple years later I was thinking, you know what? I'm not quite sure how this thing works, but it's probably got something to do with oxidation, which I'm going to go over with you tonight, okay? So I thought, what does the body need to oxidize well? So I thought, whatever those cofactors are, I'm going to stick them in the syringe. I'm shooting Novocaine in there anyway. I might as well put some B vitamins in and some, and then I thought, you know what, there's always inflammation in these things. Why don't I put some anti-inflammatories in there? So I stuck that in there. And then that's how all this stuff evolved that you're seeing tonight. And I'm happy to tell you that in close to 90% of cases, I don't care how bad it is, how long it's been going on. I don't even care what's causing it. If it hurts, this therapy will not help it. This therapy will eliminate it. It's absolutely unbelievable, and you will have to see this and believe. Any physicians in here using this, by the way? Okay, because if there were, you would hear about it. Okay, so I call it Prolozone, right? You're using it?
Yeah.
Yeah. Am I lying?
It works.
It's pretty amazing, isn't it?
Wonders.
Yeah. Okay. So let's start with this. You guys are pretty sophisticated, so this may be more or less somewhat rudimentary to you, but when I talk to a lot of people about things like ozone and what we call oxidative therapies, in other words, therapies that induce oxidant stress, people say, yeah, but that free radicals are bad and oxidants are bad, and how can anything good come out of something that's so bad? And I would remind them from the get-go that Arthur Schultz won the Nobel Prize for Medicine in 1904 by proving that there is no such thing as a bad or harmful substance, just bad or harmful doses of a substance. So in a given dose, anything, including water and oxygen, will kill you. In a small enough dose, anything, including mercury and arsenic, can be really good for you. So that's the sort of the basic answer to this question. But I really like this article that came out of a magazine called Mitochondrion just a couple years ago. And the title of it is The Essential Requirement for Superoxide Radical and Nitric Oxide Radical. And these two are oxidants that are, superoxide is the strongest oxidant in your body. And most people think of these as being just damaging substances. But what this article is saying is a review of the literature and saying, no, these can be damaging in the wrong dose, true, but they're absolutely essential for healing. They're essential for the formation for physiological functioning and healthy aging. So I don't know if you can read that. Well, good. The slide shows up pretty good. I'm just to read this, what the author said to you, because it tells the gist of why something like ozone or a strong oxidant, you can inject it into a tissue, why it'll actually fix things instead of ruin them. The author said, contrary to the dogma that superoxide anion and hydrogen peroxide formation and any other free radical or antioxidant stress is deleterious to cell function and healthy aging, we suggest the premise is flawed. That's scientific jargon for BS. Superoxide anion and hydrogen peroxide formation are essential to normal cellular function. In other words, if you don't have them, you die. That's what that means. Superoxide anion and nitric oxide play an intrinsic role in the regulated ordered turnover of proteins, rather than the randomly caused protein damage and inactivation. People sort of think of these free radicals as things that sort of like these bad guys that float around and just randomly just kill things and destroy it, and they're bad and nasty. What these people are saying, no, in fact, these are there for a reason. They're serving a physiological function, and yes, they can be used therapeutically. So let's just look at a few things that oxidants do, and I'm not going to drive you nuts with this. I just want to lay out a few fundamental things so you can see, and there are many, many articles like this in the literature that you could get even deeper into. But this is an article that came out in 1996 from the University of Texas, which showed that oxidants and oxidant stress stimulates growth factors. Now, growth factors are a broad term that refers to various hormones, cytohormones, and cytokines, which stimulate cells to regenerate. Okay? That's what a growth factor is. So oxidants stimulate them to work. And so a couple of quotes from this particular article. Protein tyrosine phosphorylation events play determinant roles in the cellular processes such as proliferation and differentiation. That means growth of cells, replacement of cells. Keep in mind now, when your body gets injured or something's broken down in it, you sprain your ankle, you cut your skin, something like that. Within a matter of minutes, blast cells and stem cells are attracted to that area. That area is loaded with blast cells and stem cells. What are they doing there? They're there to repair the damage so that, you wake up one morning a week or two later and your ankle's okay. The cut's healed. The whole thing's gone. What happened? And magical process was done by these stem cells and these blast cells being attracted by the injury to the area and then repairing the damage through the impact of growth factors. And so this enzyme, tyrosine phosphorylase, plays a role in that. And what the authors here have to say is we have recently reported that hydrogen peroxide, an active oxygen species in a cellular oxidant, stimulates growth response events in vascular smooth muscle cells. Our findings show that hydrogen peroxide stimulates tyrosine phosphorylation of several proteins during the epidermal growth factor receptor. Epidermal growth factor would be that growth factor that primarily affects epidermal tissues like skin and the interior of blood vessels and such. In other words, this bad amino oxidant actually stimulates the cells that fix stuff. Oxidants also activate the growth factor receptors so that once they stimulate the cells to produce these growth factors that could initiate healing, they then stimulate the receptors that the growth factors interact with. So they're kind of hitting it from both sides. And this article comes from the Journal of Biological Chemistry, and the authors say that these data establish a novel role for the mitochondrion as a proximal target specific to hydrogen peroxide-induced signaling and growth factor transactivation. So what all that means is that if you read this article, hydrogen, the way the receptors get activated so that they respond to that growth factor is through the oxidant action of hydrogen peroxide. Now you might asked the question at this point, well, geez, I thought he was going to talk about ozone. He keeps on talking about hydrogen peroxide. And ozone, in fact, is a natural substance. Scripps University published a paper not too long ago showing the white cells can make ozone. But the point is that any oxidant will do this. Hydrogen peroxide is a water molecule with an extra oxygen stuck onto it. Nature doesn't like that. It wants to get rid of that oxygen. It just likes plain old water. Water is a much more stable molecule. So that extra oxygen in hydrogen peroxide wants to be given off. And that's why it's an oxidant. The same is exactly true for ozone. Ozone is 3 oxygen atoms instead of 2. See, an oxygen atom all by itself can't exist in nature because it doesn't have enough of electrons in the outer orbit to balance itself off, so it's unhappy, it's unbalanced. So what it does is it goes around and finds another unhappy oxygen atom, and they hook up and they share an electron. Everybody's all happy, they're all balanced, a nice little happy couple. And they stay that way. It's very stable. If you inject oxygen in tissue, you just sit there. Don't do anything. But what ozone is we take medical grade oxygen and I pump it through a box. And in the box, it blows up all the O2s that are sharing that electron into O1s. Of course, they can't exist like that in nature, so in a hundredth of a nanosecond, whatever the heck that is, they recombine. Only a portion of them don't recombine into couples. A portion of them recombine into triplets, where you have 3 oxygen atoms sharing the electron. Now, what that means, that's not a happy situation. That's not going to last too long. They want to get back down to the 2. They're all happy with the 2, so they want to get rid of that oxygen molecule. So it's the same way with ozone. It's the same idea with hydrogen peroxide. Hydrogen peroxide, want to get rid of the oxygen molecule. Ozone, want to get rid of the oxygen molecule. So anytime you see in some of these physiology articles talking about hydrogen peroxide, you can just basically put in the effect of ozone. This is the exact same effect. When I'm injecting ozone into tissue, unlike oxygen, it doesn't sit there. It gives that oxygen off instantaneously. So it's oodles more potent than just injecting plain old oxygen. Anyhow, what the article says is that NAD, which for those biochemically minded people will recognize as the oxidized form of nicotinic acid, and this is the primary energy intermediate for all cells, NAD. So when you inject ozone into blood or into tissue, you're going to generate a lot of this NAD stuff, okay? NAD oxidase mediates transforming growth factor beta 1, induced differentiation, in this case of cardiac fibroblasts and fibroblasts. So what you can learn is that ozone stimulates growth factors, ozone activates the growth factor receptors, and then once the receptors are activated, oxidants actually start to mediate the effects of all this activity. So oxidants play a major fundamental role in the way your tissues renew themselves. Now, there are a lot of things that are different between a 25-year-old person and the 75-year-old person. One of those things is that the 75-year-old person does not heal as fast. The tissues do not regenerate themselves nearly as fast, now do they? Why is that? I will postulate to you that without question, one of the major reasons, if not the major reason, is that older folks just don't oxidize all that great. Another way of saying that is, if you could get older folks to oxidize as well as younger folks, they'd heal as well as younger folks. And that actually turns out to be true. And there are ways to get older folks to oxidize as well as younger folks. And the primary way is a way that I hope all of you guys are accessing, and that is plain old good old aerobic exercise. So that is a medical treatment, and aerobic exercise is something that young folks don't need so much. But as we get older, we need that, because if we don't get that, we're not going to oxidize as well, and amongst other things, we're just not going to repair our tissues as well. Okay, so you go out and you lift a bale, or you twist your knee, or you do something and you injure your body, and you're thinking to yourself, that's no big deal. I'm tough, you know. My body heals. I got a good body. I'm healthy. It's going to heal. And sure enough, it does. And about a week or so later, everything's okay, and you're back to business normal, and you think about it. And most of the time you injure yourself, you more or less blow it off, and you expect a complete recovery, and usually that's what you get. except sometimes you don't. So, like for me, for example, I got into using kettlebells, and I didn't really learn how to use them correctly, and I went overboard on it and tore my rotator cuff. And I thought to myself, that's no big deal. Just tore your rotator cuff. That's okay. You'll give it a little chance. You're healthy. And a week goes by, a month goes by, 3 months go by. But eventually people wake up to the point that, this one's not healing. What's up with that? It's supposed to be healing, isn't it? So if anybody out there has a chronic pain or a chronic injury, a bad knee, bad back, bad neck, bad elbow, bad something, and it's not healing, you need to ask yourself the question, why? Your body always heals. How come it's not healing this time? Well, the answer in my mind always comes down to one fact, and that is poor oxidation. If you had adequate oxidation, your body would heal. Now here's the point. If I injured my shoulder and it wouldn't heal there, does that mean I have bad oxidation all over? No, it doesn't really. Because when I injured my shoulder, I measure oxidation in the clinic. And I happen to know my oxidation is like a young person, like a 25-year-old kid. So, and that's not accidental, it's because I do things to make it that way, by the way. But, so I knew it wasn't that generally I had poor oxidation. But it is that in that shoulder I had poor oxidation. And what it turns out is when you have an area that's hurting, an area that won't heal, the reason is always because there's an area, a localized area there of decreased oxidation. Decreased ability for the cells to utilize oxygen to generate these oxidants that cause the healing. Okay? So, consider this. There's a very poor blood supply to joints and to ligaments. So much so that if you put a transducer into a joint or a ligament that measures oxygen tension, and then you move that transducer about 2 millimeters over into non-joint or non-ligament tissue, you will see easily a 10-fold difference in oxygen tension. Sometimes a 100-fold difference. It's very poor vascularity to joints and tendons. And that's just the way it's set up. I don't know really why it's set up. Maybe it's because we tear them all the time and God didn't want us to bleed to death. I'm not quite sure, but that's just the way it is. We have very poor blood supply, by definition, anatomically, to joints and ligaments. So, why do we get pain mostly in joints and ligaments? I mean, when was the last time you banged your arm or banged your leg or injured some non-joint, non-ligament, non-joint part of your body and it didn't heal? That almost never happens. It's almost always a joint or a ligament that goes to the spine or the back or something like that. And this is why. Because by definition, the area is already in a kind of a compromised circulatory position. Then you look at the aging effect. Well, the older we get, does our circulation get better usually? Not usually. Usually your circulation gets worse the older you get. So you combine that. So, you know, when I'm fixing knees and stuff, I fix a few young people's knees, but mostly it's people over the age of 50 or so. Those are the kind of knees I'm fixing. And that's partly why, too. Also, once you get, so here you got a setup. Say like you're 50, I'm a 63-year-old guy, so I go out and I screw up my shoulder, and I said, okay, maybe my circulation's not so great. You know, already got poor blood supply, all those ligaments in the rotator cuff. And then after I injure it, I'm going to get edema in there. Edema decreases circulation, right? And I'm also going to get inflammation in there. Inflammation decreases circulation. And incidentally, inflammation, all by its little old self, affects the mitochondria in such a way that it suppresses mitochondrial oxidation. So it's got its own anti-oxidation effect. If I throw on top of that a little nutrient deficiency because maybe my diet is less than perfect, I might be in a situation where that rotator cuff won't heal, especially if I really tear the heck out of it and it's a big old wound. And that's the situation I was in. So for 9 or 10 months, I put up with this thing, completely expecting it to heal like it's supposed to. It never did heal until I had my nurse start shooting ozone in it, and then, you know, it's pretty good. In fact, it's absolutely normal, I'm happy to tell you. But you do venture into, you do get into this vicious cycle where you get decreased oxidation, from the injury and from just the way cells, where the way ligaments and joints are, and due to the fact you've aged, you get increased free radical damage. It leads to more inflammation, more edema, which leads to a further decrease in oxidation. It's just a vicious cycle. It goes round and round and round. And so when a patient comes in my office and they say such and such hurts, or such and such won't heal, and often they can't even remember what the heck it was. So my knee hurts. Well, when did it start? I don't know. A lot of times they can't remember. My back hurts. It just hurts. It hurts every morning. I have to get out of the chair and I kind of walk like this, and I know you guys know what I'm talking about. So that kind of thing, right? So that kind of thing. And this is why it won't heal. So the good news is, all you got to do is fix this stuff and it heals. So what is Prolozone? It's kind of what these little old ladies taught me over the last few years. If that's the problem is inflammation, well, we put some anti-inflammatories in there. Right? I happen to use homeopathic sorts of anti-inflammatories. For the doctors in here, I like to use Tromeo. And we also put some nutrients in there. I figured, well, maybe then I get all the nutrients. So what's the key nutrient for oxidation? Would probably be B12. So we put some methylcobalamin in there. And folic acid is another important one, and that's also frequently deficient. So we put some folic acid in there, and then I put all the minerals in there. So we got a solution that's got some anti-inflammatories. We got some minerals in there, and then we throw in the granddaddy. We throw in the oxygen molecule to the mix. And what the oxidants do, they're going to stimulate all the regeneration. Now we've got all this stuff in there. What's the circulation supposed to bring? You got those little blast cells and little stem cells sitting there, and they're waiting there for some stuff. What are they waiting there? Give me some oxygen, okay? I need some oxygen. I need some oxidants down here. Get me rolling. I need some growth factors. I need some vitamins. I need some minerals. And, I just can't get it because the circulation is compromised down here. Well, I just bypassed all that. I say, here's the delivery anyway. So what if your circulation didn't deliver it? I am with my syringe. Here's a bolus of it right now. And we start the process into healing, and we start breaking the vicious cycle. Every now and then you can get a healing in just one treatment, but normally it takes a series of them to completely break that cycle. The term prolozone, probably ought to pick another term, by the way, because everybody mixes it up with prolotherapy, and it's totally different with prolotherapy. But anyhow, it's a good term in as much as the Latin word prole means to regenerate or rebuild, and that's what we're doing. And of course the word ozone, so it's regenerating or rebuilding tissue that won't do it all by itself by injecting ozone into that area. You'll also see on the third bullet on this slide, I'll also show you a slide which I was really excited about, came out last year, and it shows that ozone in and of itself, in ways that don't even have anything to do with what I've told you about so far, eliminates pain. So I'll show you that slide before it's over. So there's another way, besides everything I've told you, that this is so remarkable at getting rid of pain itself, such that there's a fellow named Ray, R.E., Lamberto Ray, who's a physician in a little town called Verona, south of Venice. And he and I have been in correspondence for a long time. He's a really nice guy. And they have a soccer team over in Verona, and these Italians are pretty serious about their soccer, and to say the least. And so they run their doctors out of town, the doctor to the soccer team if they don't do the job right, that kind of thing. So what Lamberto says, he says, you know what, man, they love me. I said, what do you do? He says, well, after every soccer practice, I sit on my chair with my syringe and my ozone generator. I'm just sitting there, and the guys walk by, and I say, where does it hurt? And they say, here. Next. That's what he does. He says, my soccer team's doing real well, and they love me. Okay. How does prolozone stimulate healing? You guys are probably starting to get a little of the idea here. First, the homeopathic anti-inflammatory medications are injected into the area to reduce the inflammation and the swelling. So a needle goes into the area and stuff is injected in a liquid, okay? That automatically increases the circulation to that area. Massage will do that, won't it? And there's various electrical treatments that do that. You guys, you stop and think a little bit. All those things that normally fix you, what are they doing? They're increasing circulation to the area. The problem is a lot of the times you go get the massage and stuff and your back still hurts. So what's the last option here? This is one really good way to get to it. After that injection goes in, then the area is injected with vitamins and minerals that are critical for the oxidation process to happen. And lastly, we inject the area with ozone. Now, I could inject it with hydrogen peroxide, and I have injected it with hydrogen peroxide. But here's something I want you to remember. We have done ultrasounds on after what happens when we inject liquids and when we inject gases into tissue. And as you would imagine, when I inject liquid into a tissue, it kind of stays right where I injected it. When I inject the gas into a tissue, it diffuses all over. So I don't have to be a really great marksman anymore. I'm like Clint Eastwood with a shotgun. Okay? Anything close to me, boom. I don't need to be too pinpoint like with the 22. I'm just blasting that area. So if the guy tells me it hurts here, you know, and when people say it hurts here, they don't quite know where it hurts most of the time. It could be there, it could be there. I can narrow it down. Sometimes people say, I say, where does it hurt? Say, the entire back and lower legs. What am I going to do? I need a gallon of hydrogen peroxide to treat that. So what we do is, that's one of the advantages to a gas, is you just get it anywhere in the area, it's going to diffuse all over. I can shoot a gas in your lower back, and you can tell me you feel it up at the top of your head. This is standard operating procedure. So that's why we use ozone. It's a gas, and it does a much better job that way. And then finally, the result is that the tissues get what they need to heal. And as long as they heal, the circulation in the area is reestablished. And then they don't need me anymore. This is not just a make me feel good sort of thing. It's not like an epidural or a cortisone shot or something. This fixes the problem.
Question. So you
Yes.
do those 3 steps sequentially, not all at once?
Sequentially. So I'm sticking a needle in, I inject in the liquids, and I might have 3 or 4 different syringes of stuff. Now I will vary it depending on the patient. I can inject hyaluronic acid in there. I can inject a homeopathic preparation called Zeal. I can inject specific minerals. I can inject growth hormone. I can inject all kinds of stuff in there. Ultimately, when it's all said and done, then the needle's in, and I'm just switching syringes like that. So the patient only actually gets stuck once. It's a pretty painless procedure in as much as the needles are small, they're incredibly sharp, you hardly feel it going in anyway, and I am so nice that I actually freeze up the little skin with some freezing stuff before I put the needle in there.
How long is the needle?
The needle is... the needle is long enough to get to where it needs to go to, Mike. Okay? So you figure that out. If it's your finger, it would be a relatively short needle. Yes, sir?
Is this all done in a single session, or how many percentage of your patients need follow-up?
Yeah, so rarely does a patient get fixed. You know, probably I'm going to answer most of these questions. I'm going to leave some questions answers at the end, because most of these questions we'll deal with, but most people are going to need from 3 to 6. It'll vary a lot.
How far apart?
But what you can expect is immediate decrease in pain. So that's what should happen. Within a matter of minutes, the patient's just saying, yeah, feels better. What you can expect is regeneration of cartilage and ligament, and we have x-rays to show that. What you can expect is a true cure of most chronic injuries and degenerative processes. All the total knees, total hips are a little harder, but I mean hips that are so bad you've been told they need a total hip or a total knee or a rotator cuffs or a slam dunk. Carpal tunnel's a slam dunk. Low back pain's almost 95% of them. I don't care if they've been going on for 20 years and people walk like this. They'll be walking, skipping around. It's unbelievable when you see what this stuff will do. The response to the treatment varies from person to person. Of course, it depends. Now, the older you are, the more treatments you're going to need. And frequently, when in older folks, and by that I'm going to say like 70-ish, 75-ish, when you get in hormone deficient type territory, probably need to get those hormones replaced. And you need all the other stuff, really helps. So the healthier you are, the more, the better your bowels are, the better your nutritional status and so forth and so on. All that really helps. Younger folks, they're a slam dunk. 22-year-old comes in with a chronic injury, 1 or 2 treatments. Bing, that's it. But most people, somewhere between 3, 5, 6 treatments. We typically space them out about 2 weeks apart. You can't do them every day, which is one of the bummers of this, and why I teach doctors how to do this, because the only way somebody could see me if they came from back east was they'd have to move out and stay in Carson City. So we want doctors all over the country. So if you know of doctors that would like to know about this, we do teach them. I'll give you some information on how to refer your doctors to learn about this. I can't do all these people myself. But for you folks around here, for example, I do have a lot of folks around here that will drive the 3.5 hours up there. But you have to do it every 2 weeks, and for 2 or 3 times until you get pretty substantially, and then we'll kind of stretch it out every 4 weeks, every 6 weeks, or so forth until you no longer need me.
Does it work with animals?
It does work with animals. Yeah, I've done a couple of dogs, and it does. And it's sort of, I have no idea how to inject a dog knee or a dog leg. I don't really know. But I just like that nurse showed me. I just go in kind of the area and shoot it up, and it really does work very well with animals. If you come to my clinic, you have to sign a little booklet now with about 30 pages of informed consents. Sorry, I didn't make this up. It's the bureaucracy, okay? Read the small print if you want, but it'll probably take you an hour and a half. But I do not have an informed consent for prolozone therapy. And that's because there's no need to. I've done thousands and thousands of these in all kinds of situations. I've done it wrong, I've done it right, I've done this dose, I've done that dose. You can't hurt anybody, period. There are 0 zip side effects. There's literally no downside to this except your time and money.
How much?
The wagon outside, all pretty.
It depends on the body area. I charge $350 for a back. I charge $250 for a knee. I charge $350 for 2 knees. You can call my office and get an idea, but that's generally. It is insurance reimbursable, by the way, for most insurance companies, but not for all, of course. Yes?
What do you have advice for trigeminal neuralgia?
Trigeminal neuralgia works fabulous for that. There are treatment, and also for TMJ, there's treatment points inside the mouth that we do. For dental abscesses, for cavitations, anything dental is remarkable for. In fact, the American Dental Association, a month ago, actually put in a new code so that dentists could charge for using ozone therapy. I find that astounding, but that's just...
You know the code.
TMJ is this joint here, this jaw, where they get sore right in here. It won't treat cancer. It's not going to treat cancer. This is for pain. Pain and the conditions that cause pain. And of course, I guess cancer will cause pain, but it'll alleviate the pain of cancer, but it won't fix the cancer. Okay.
As a little testimonial, the day before my son was born, I had a wisdom tooth removed urgently. Dr. Gallagher injected ozone, and I never had any pain. It was amazing.
Astounding.
Off the thing out of my phone.
Thank you.
That was fine.
Hey, don't believe me. Believe this man. You have to see this to believe it. Anything associated with pain, chronic necks, backs, rotator cuffs, degenerative joints. Normally we're talking about hips and knees and spine, degenerative discs, plantar fasciitis, which is very often refractory to treatments, cured forever, back running again. Carpal tunnel syndrome is pretty much a slam dunk for that. TMJ, sciatica, heel spurs, neuromas, tennis elbow, sciatica, sinus infections, anything up in here can be very good for any pain from sinuses. Pelvic disorders, pelvic floor syndrome, astounding for this, absolutely astounding. There are a lot of women that have interstitial cystitis, a lot of women that have pelvic floor disorders. It can be a very terrible thing. Fix it in 3 times. Astounding. Fix one man with this, then pelvic floor disorder is relatively uncommon in men, but we did have a man that had that. Non-union fractures, I've had people come in, I had a lady come in and say, my shoulder's broken, it's not healing very quick. What we can do, we injected ozone in there, helped it heal very quickly, kind of broke that stalemate kind of situation in here.
What about overactive bladder?
Well, overactive bladder, if it's interstitial cystitis, this will help. But I mean, there's other causes. Usually that's a hormonal issue. Yes,
Can you compare prolotherapy, please?
I will in a sec, yes.
What concentration? How strong is the ozone?
Okay, that's a good question. I wasn't going to get into that kind of technicality, but I use a 9 gamma now, anywhere between a 9 and a 20, but normally a 9.
Have torn meniscus.
Yeah. Oh, yeah. A torn meniscus, you just had. If it hurts, folks, if it hurts, we shoot ozone into it. That's it. You can call me up, and that's what I tell my wife. My wife feels all the questions people call up. And she says, Frank, what about this? What about that? I said, look, don't ask me anymore. If it hurts, you tell him we fix it. Okay? But this guy says that he's got it from blah, blah, blah. He's had 9 surgeries. If it hurts, you tell him we fix it.
So the torn
Period. It's a treatment for pain.
Does it actually repair the torn meniscus?
Yes. Yeah, absolutely. You have stem cells and blast cells there that when they get affected by these transforming growth factors and such, man, they're going to town. And you're breaking the cycle that's stopping them from doing what they're supposed to be doing.
And insurance will cover that?
Well, a lot of times insurance will cover, but different insurance companies, Yes, Virgil. Spinal stenosis, okay. True. When somebody calls me up, if they say, I got spinal stenosis, what my wife is supposed to say is, does it hurt? If they say yes, says, come on up. But if they say no, my spinal stenosis causes me weakness when I walk, I can't fix that. That needs surgery. But if it hurts, folks, it's simple. If it hurts, this fixes it. If there's no pain involved, I can't help you. If you're paralyzed or, got some kind of musculoskeletal thing, I can't help you.
So you hit it with a hammer first and then call you?
You might get better coverage that way. Yes, ma'am.
I just want to clarify this because I have rheumatoid arthritis. I have bone on bone. And I've been told that the cartilage is gone, there's nothing they can do. And so you're telling me there's a possibility with this, I can get injections that will restore the cartilage in my leg even though I have rheumatoid arthritis?
Sure.
Well, what's your number?
Yeah, for sure. You know what? Let me finish this lecture, and we'll take all the Q&As, because I might be covering a lot of your Q&As, and then I'll stay here as long as you want to ask questions, but I know that I do have a kind of a limited time. I want to get through some of this, because I got cool stuff. At least I think it's cool. It's nerdy stuff coming up here. So anyhow, scars, whatever. The value of prolozone is that it actually corrects the pathology of the disorder. It's not just sort of a pain thing per se, although it is that. It's not just that. It actually fixes the thing, like the torn meniscus or the bad disc or whatever it is. Okay, so now I'm going to get into some of the international studies. I will say that these studies are about the use of ozone, just ozone injected, no procaine, no anti-inflammatories, no homeopathics, no vitamins, no minerals, nothing. Not the whole Prolozone procedure, just pure, simple injection of ozone. If in these studies they would have used this more comprehensive procedure, they'd have gotten infinitely better results. But there's a lot of studies coming out now. This one was just from 2005, and this was reported in the American Journal of Neuroradiology. It's entitled Intraforaminal Ozone versus Periradicular Steroid Infiltrations in Lower Back Pain. So what that means is that they took ozone and then they injected right where the pain was, and then in some other people they injected steroids, and they're kind of comparing them to how well it worked compared to steroids. Now we all know steroids don't fix anything, but they're just looking at the treatment response, and the conclusion that oxygen ozone treatment was highly effective in relieving acute and chronic lower back pain and sciatica. The gas mixture may be administered as a first treatment to replace epidurals. There is no need for epidurals anymore. These things are just a waste of time, you ask me. A lot of people I come to see with chronic back pains have had umpteen epidurals. And maybe they work once and they're just not, this is the way to go, not an epidural. Here's one on 220 subjects. This comes out of Dubai. This fellow here, Al Jazeera, actually came to one of my seminars a couple of years ago. And so he went back and published this article on pain-killing effect of ozone oxygen injection on spine and joint osteoarthritis. So this is specific spine arthritis, so the doctor tells you got arthritis in your spine, osteoarthritis, or the doctor tells you you got osteoarthritis in your knees or something. Then you looked at 220 subjects. The conclusion was this study validates the pain-killing effects of ozone oxygen injection on osteoarthritis of both the joints and the spine. Its long-term effect on pain advocates, in other words, it works a really long time, like forever if you do it enough, advocates the likelihood of some histological changes as its mechanism of action. By now, I think you have an idea what those changes would be. Here's one that comes just this last January. Now, I found this one astounding, and I actually put out the $35 to buy the whole article because it has such an intriguing title. Listen to this title. A single subcutaneous injection of ozone prevents allodynia and decreases the overexpression of pro-inflammatory capsaicin in the orbital frontal cortex of neuropathic mice. Isn't that awesome?
Wow. Now, what does that mean?
Christmas is coming up. You can get this on the internet if you want. So what the heck is allodynia anyway? So allodynia is a really neat term. Basically, the definition of allo is other, like allopathic medicine means you treat something different than the disease, okay? But that term allo comes from the Greek word meaning other. So it's an other pain. Dynia means pain, so it means other pain. So it's a painful response to a usually non-painful stimulus. Not when you get out of your chair. That should be non-painful, right? So allodynia is when it's not. It hurts. Normally if you walk along, if you bend your knee, if you lift your arm, do this kind of thing, that should be non-painful. But in allodynia, it hurts. So that's the definition of allodynia, okay? And then what the authors say is, these preliminary data show that the peripheral neuropathy induced overexpression of pro-inflammatory, pro-apoptotic capsaicin in the orbital frontal cortex. What all of that stuff means is that there's inflammation, biochemical inflammatory sorts of communication going on in injured cells. That's what all that means, okay? By mechanisms that are as yet unknown. So they don't quite know what's going on. But they do know this much. Can regulate the expression of the genes that play a pivotal role in the onset and the maintenance of allodynia. And ozone gets rid of that. So this is when I was telling you that it does something, it gets rid of pain in another way that's different from just correcting the condition that caused the pain. It actually gets rid of pain. Because it changes the way the cells that have been damaged express these capsaicins. This one is from Spine, the medical journal Spine. And this is, again, just a few months ago. Lots of stuff coming out now, just in the last 12 months. I've been doing this for almost 15 years, and nothing coming out. And doctors always say, well, you know, I don't believe anything you say. Show me something that's printed, show me some published stuff. And so I was just a little bit happy to see all this stuff come out in the last 12 months. But this one is called Intramuscular Ozone Oxygen Therapy in the Treatment of Acute Back with Lumbar Disc Herniation, a multi-center randomized double-blind clinical trial of actin-stimulated lumbar vertebral injection. So in these, what they did is they took these people and they put them on the table and they stuck a needle in their backs and they injected ozone around there. And then another time they would take the needle and tell them they were doing that, only they just kind of like poke the skin a little bit and kind of push on it and make it feel like they just got the injection, only they didn't get anything. And so that's how they said, well, how do they compare one to the other? And what they found out is that the placebo one worked about half as well as the ozonated one. Shows you how suggestive people are anyway. And then the quote, but the quote is good. I like the quote here. It should nevertheless be pointed out that the pathophysiology of low back pain and radicular pain, that means like sciatica, pain shoots down your arm, such, has not been fully understood. Now, if you go talk to your orthopedic surgeon, they say, oh yeah, we know what does that. You just go in and you cut stuff out and it fixes, you know. But the truth is, they don't really know what causes this pain. Indeed, the mechanical effect of nerve root compression does not seem to completely explain radicular pain. I can't tell you how many people have had chronic sciatica that go in and get their back operated on and still have chronic sciatica. Maybe it's changed a little bit, but they still got it. So this whole idea of just going out and taking out the bad stuff and you're going to fix the thing, there's more to this story than that. Inflammatory changes have been observed in lumbar disc and periradicular tissues that's around the disc. In people suffering from lumbar and radiating pain, and a correlation has been found between the inflammatory changes in the herniated lumbar disc specimen, the inflammation around the specimen itself, and the outcome after lumbar disc surgery, with a lower VAS, that's a pain rating, in those patients showing inflammatory changes in the herniated disc after surgery. So it's just talking about inflammation being present. So inflammation is a major cause of this pain, not just the mechanical issue of the disc being there. So if the disc is there and you get rid of the inflammation, what they're telling you is you can have the disc there. You don't have to take that thing out. And I can't tell you how many people that we've seen that are just like that. You know, surgeons just want to operate on them. They might have been operated on 3 times. Surgeon says, just one more. Yeah. And we're going to take care of that because that thing is sitting right there. See it? It's the MRIs right there. I don't get MRIs. I mean, I will if the patient wants me. I don't get MRIs. I don't do X-rays. You know, fine. You want to spend your money? That's great. A little radiation might kill something bad in there. But we don't necessarily do them, which is one of my downfalls, because I can't sit here and show you umpteen before and after MRIs, because I don't do them. But they're not necessary, is what I'm telling you, to get all these kinds. The pain just goes away and the patient's fixed. I don't need an MRI. And if the MRI showed this problem was still there, would you care? I mean, if you had back pain and the MRI shows a problem here, and the surgeon says you got to get rid of that, and then later on you don't have any back pain, and you get another MRI and the thing's still there, you're going to have that removed? I don't think so. Okay? And that's what this study is talking about. And this one is infraretinal. This is the same one that we just did. Okay. And then recently in Cuba, they had a conference where they presented a paper where the conclusion of that paper was we conclude that the intra-articular ozone is an effective therapy in the treatment of grade 3, that's a bad one, knee osteoarthritis resistant to treatment with things like Celebrex and the NSAIDs and such. And this one comes off of a news article that was quoted in the website Cyber Rounds. It has to do with a big Toronto study that's now going on, approved by the Canadian FDA, that are looking at, the Canadian FDA has now approved for large-term studies to be used on ozone for low back pain. But this Toronto team, in order to get that approval, examined the results of 12 previous studies involving over 8,000 patients of ozone treatment of herniated discs, and the study showed ozone therapy to be just as effective as surgery, but without a short recovery time and a much lower risk of complication. I'm here to tell you it's infinitely better than surgery if you use this whole protocol. At least that's been my experience. So I've got a few things here, and then we'll get to some question and answers, but this is my pastor, and he hurt his back. And he had a big disc extrusion with significant size. It's a rounded extruded component compressing the fecal sac in the right paramedian orientation at L5S1. This is the most common place you get it. And we treated him, and lo and behold, we did get an MRI on this guy because the surgeon swore to him that he's going to be paralyzed and he needed to have this big, huge extruded disc removed. And so we do have a before and after MRI on this. And as you can see, this the author compared back the old one and said there's no significant disc protrusion anymore. Where'd that disc go? I will maintain to you that it went back where it was. Now, it could be that I melted it out. I might have oxidized it out.
Yeah, he melted it.
That's what the surgeons do. They just cut it out. So even if I did oxidize it out, I'm no worse than the surgeon. But one of those previous studies I showed you where you know what they do in Europe a lot now, and I think maybe in some places in this country, is they, by fluoroscopy, take a needle and put it right into the disc that's herniated out. And they inject ozone into that disc and it melts the disc. And that's the end of it. They don't need surgery or anything. So it's a more benign process. So one of those studies I showed you, they compared, well, what's it like to do that under fluoroscopy to the tune of $3,500 versus to do the kind of the technique that I do, where I just kind of go around the area with a shotgun and just blast the heck out of it. And basically, there's not much difference. So I'm assuming what we did is we either reduced the inflammation to the point where the disc was just slipped right back in, or we just melted the disc away. But any point, the point is he's completely 100% asymptomatic, and there's no evidence of disc protrusion. We do this all the time in the clinic. Just happen to have an MRI in this guy. Now, again, I don't have a lot of x-rays, but in the light, just the hair. Maybe you can just turn it off for a second. That would be easy. So you can, these are the same knee. This is 3 months afterwards. Now that's a significant amount of cartilage improvement there. Okay? It's a young person, so you're going to get a much better result. But this is your basic bone-on-bone that needs a total knee. Doctors will tell you there's no cartilage there. That's BS. How do they know that?
They don't.
They stick a scope in there and they look around and say, nope, can't even see a molecule of cartilage down there. There's no blast cells or stem cells either. They can't see that stuff. They don't have a clue. They're just looking at the x-ray and, admittedly, you can't be too much there. But there's enough to regenerate. And if you put all the right stuff in there, that's the kind of result that you can see. Okay, we can have the lights again because that's the last one of those I have. Okay, there was a question about sclero on prolotherapy. So what's the difference? Prolozone uses oxygen to promote a healing and the concept I told you, whereas prolotherapy uses inflammation to cause scarring. They're entirely different. Prolotherapy is extremely painful. Folks, I used to do prolotherapy. That's what kind of got me into this. Prolotherapy works great. Works fabulous. We fixed a lot of people with prolotherapy. It's very complicated, it's difficult, and it's expensive and stuff, but it can work great. But it's not in the league with this stuff. It's very painful. Patients that have had prolotherapy and it's failed have come to see me, and half of them bring their crutches with them when they come to the clinic. And it took me a while to be like, why are you bringing your crutches? Well, when I got prolotherapy, I needed them to leave the office. You don't need them here. The pain often persists to days to weeks after treatment. In contrast, patients with the prolozone feel better immediately. Prolotherapy requires many injections, so if I'm going to treat a shoulder, I'm going to have to go like maybe 6 different spots in that shoulder for the prolotherapy. For prolozone, it's my shotgun. Just shoot the whole shoulder once. That means that ultimately it costs less and it's faster and easier to do. I can do a shoulder in 5 minutes, whereas with prolotherapy it would maybe take me 20, 25 minutes, depending on how complex the issue is. Prolozone therapy is especially effective in regenerating cartilage and stuff. Prolotherapy really won't regenerate so much. It's more of a scarring thing. So when you go to, it won't actually regenerate the cartilage in the knee most of the time. Normally use prolotherapy around joints to kind of stiffen them and tighten them up and get their function back and the stability back in that. So it's not the same as, it's a very, very different thing. So if you've had prolotherapy and it's worked great for you, fabulous. But if you've had it and didn't really take care of all your problem, you should try this stuff. Medicare, I don't know. I don't take Medicare, so I don't know if Medicare covers this or not. Does anybody know if Medicare will cover prolotherapy or sclerotherapy? They do not. I would not imagine they would. So they probably don't cover this. I have been training doctors for almost 12 years now. We've trained thousands of doctors in how to do this. Unfortunately, due to the fact that it's ozone and the bureaucracies in the various states kind of look down on practitioners doing anything other than the standard approach, many of those doctors do not want to be listed on the website. But a lot of them are listed on the website. So you can, if you have friends in various parts of the country, you can go to www.oxygenhealingtherapies.com and they'll list all the doctors there and all the trainings that they've had, and they've learned everything that I can tell you. Everything that I do with my patients, that's what they've learned to do. So it's the exact same protocol and everything. The ingredients used in prolozone therapy are 100% natural. There's nothing that's going in that syringe that's not already in your body, so it's not patentable. You can't patent this thing, which is good for you, because then it really gets expensive. But it has not been, this is not an FDA-approved sort of thing. However, in most cases, prolotherapy is covered by health insurance because we bill it under the prolotherapy codes, and we can make a case for the fact that that's a reasonable code to use.
Under the what code?
Under the prolotherapy codes. There are codes for prolotherapy, strengthening ligaments. There are also codes for... what?
Even though you're completely different procedure.
Well, they are and they aren't. I mean, biochemically, we understand that there's a different rationale. But truthfully, ozone's an irritant, and I'm injecting an irritant. Okay? And as far as I know, there may be some prolotherapy effects to this stuff. I used to think that's how it worked. Again, I'm a prolotherapist coming into using this, thinking, well, this is just another cool little prolotherapy thing, only it's a gas, so it's better. But I found out that, unlike with prolotherapy, you see, you can't take anti-inflammatories because it works by inflammation, right? So they say you can't have an aspirin, you can't do anything that's anti-inflammatory that's going to affect it. I put anti-inflammatories right in the syringe, and it works just as well, if not better. So I know it's not working mostly by a prolotherapy type of thing. If you're a doctor, or if you want your doctor to learn about this so he can do it to you, we have courses up in Reno twice a year, and you just go to ozonecourse.com. And that's the show. I'm going to stay for some question and answers, so yes.
I think I'm your worst skeptic. I've got a lot of questions because I'm used to selling drugs for 22 years in pharmacology. But
Oncology.
here I am, growing up in Southern California, hearing ozone reports every day. So you're injecting a poisonous gas, goes throughout the body. Aren't you worried about embolisms?
What if you happen to hit a vein?
Right.
Okay. First of all, oxygen is a poison.
No, we're talking ozone.
No. Oxygen is a poisonous gas.
Right.
Ozone is a poisonous gas
Right.
too. You're right. Okay, so when I'm injecting it, if I don't want to inject it right into a vein or into an artery, although I've done that. So to treat gangrene of a leg, what you can do is inject the gas directly into the femoral artery. And that's been described and used in Germany for a long time. I learned that over there, and I've done it on occasion to save a gangrenous leg. So you can do it. Can you inject a big old huge bolus in there? No. You go real slowly, nice tiny little bubbles. So yeah, embolism's a real thing. But when we do these treatments, like I say, I'm going in areas that don't have any circulation. So the only time that I'm going to even get close to a vascular spot would be in certain areas of the neck. Every other place I inject, there's just no danger of this.